Hi, my name is Donovan Maust, and I'm one of the principal investigators of the National Dementia Workforce Study. I wanted to share some information about the linked data resources that will be available in the coming year. So this first slide is just to highlight the NIA's intent with this proposal is, yes, to field a survey of the workforce, but equally important to have a way to actually link those surveys to data to inform the outcomes that persons living with dementia receive to really understand the care that they're getting. And so this linked data is a really important element to really realize the potential of the surveys. So just as a very brief high-level overview, there are 4 surveys sort of grouped by setting of care. With the 3 organizational surveys, there's also an administrator survey to really understand the way that the care is organized and delivered within the participating, say, nursing home or assisted living community. I'd encourage you to watch the videos that'll be also available about the surveys, sort of much more information than I can share here in the single slide, and then also about the sample frames that really guided how these the samples for these surveys were developed and selected. Okay, but getting to the linked data, which is what I said we'd talk about. If you go to our website, what I'll be talking about, you can find under the surveys and data and then the data linkages page. A lot of this is mapped out at a very high level, but more additional detail will be coming. So I kind of think about we have 4 buckets of linked data, and we'll go through each of those. The other thing to keep in mind is that at this point, when I'm talking about the surveys, I'm talking about the versions of the surveys that will be used to link to these other data sources. Those versions of the survey will have some additional information necessary to do those linkages. They will only be available within the linkage program, which I'll talk about in the next slide. The non-linkable versions of the surveys, the public use files, will be available separately. And again, the version of the surveys that I'm talking about are the versions that will be available within the linkage program. So what is that? Actually, if you're not familiar, this is an NIA-funded platform to facilitate data linkage of NIA-funded projects with CMS data and other types of data to make sure that it's done in a secure cloud-based environment. So all of our data linkage will be done within that linkage program. And now to walk through the different types of data that will be available to link. So first, you might remember from that high-level overview of the surveys that I presented, within the organizational survey, so the nursing home survey, the assisted living survey, and the home care survey, there will be a companion administrator survey for each of those. If you want to link the surveys, both of the administrator, which gets into some characteristics of the organization, benefits offered by the organization, whether unions are part of the workforce. If you want to link that to respondent surveys, that is done within linkage. And so again, if you want to be able to link those 2 different surveys, that is done within the linkage platform and can't be done with the publicly available version of the survey. So the next bucket are environmental linked data sources to really get at the local context. Obviously, if you're the only psychiatrist working in the county, that might influence the type of care that you provide. If you are a nurse and working at in a county where there's a single nursing home versus where there's a dozen nursing homes, obviously that might influence your environment. So the way that we can link to these geographic based data sources is through the FIPS code. And so given survey respondent based on either their primary practice location, their employing organization, the survey will get uploaded to the linkage platform with that FIPS code. So we can then link to these various geographic data sources. Beginning with the AARP has this annual long-term services and support scorecard with 50 different indicators, which obviously are relevant to both the workforce and the care that persons living with dementia receive. The area health resources files, which is just a vast data source that really informs in particular, the healthcare supply in a given county, the number of home health agencies, the number of hospital beds, the number of nursing home beds, the number of primary care providers, all at the county level. So you need that FIPS code. Medicaid expenditures, the balance of expenditures in a given state on institutional care versus home and community-based services. Again, we'll have a annual state-based report available to get at this type of spending. And then finally, the social deprivation index, which is the county-based measure that pulls on these demographic characteristics from census data. An additional sort of bucket of linked data that will be available are what we're calling claims-based summary files. So many of you may know that if you want to do research using beneficiary level sort of raw CMS data, that just requires a significant amount of time and expertise. We would really like to facilitate easier and more rapid ability to really understand the care that persons living with dementia are receiving. And to help facilitate that, we figured it would help to generate these claims-based summary measures so people didn't have to use raw claims-based data themselves. In order to do that, the community clinician survey, for all of the respondents to the survey, we have their NPI, which is their National Provider Identifier, which uniquely identifies that clinician within CMS data. Similarly, for participating nursing homes, we have their CCN, which again, uniquely identifies that facility within CMS data. And so with those pieces of information, we can then identify beneficiaries who received care from those providers or in those facilities and develop these claims-based measures that might potentially be of interest to researchers. Again, to facilitate and speed the ability to do research that's really getting at the care that's delivered. In year one, these claims-based summary files will be available for the community clinician and the nursing home staff surveys, with plans to expand it to the other surveys in subsequent years. So for example, in the community clinician file, we will determine things like how many patients with dementia does this provider care for? How many patients do they care for overall? So you can get a sense of the extent to which patients with dementia are a minority or majority of the patients of the clinician's panel. What type of setting does this clinician provide care in? Is it entirely outpatient? Do they do inpatient work? Do they provide care in a residential nursing home setting? A number of panel characteristics, both demographic and clinical, in addition to a particular interest of mine, prescribing characteristics. So what proportion of the clinicians, patients with dementia, receive opioids or antipsychotics or anticholinergics and several other medication classes? There's a draft data dictionary available on the website that goes through the large number of these claims-based measures that we'll be preparing that will be available for use in combination with the surveys on the linkage platform. One trick here is that there's a lag in data availability. So the fee-for-service information is the most recent available. So the initial year one claims-based summary file will be using information from fee-for-service beneficiaries. And then in future years, when the MA data catches up, we'll go back and update those year one summary files. So it includes both fee-for-service and Medicare Advantage beneficiaries. We're currently working on finalizing the claims-based summary measures available in the nursing home file, but it will be similar to what will be available for the community clinician survey with resident demographics, both dementia and overall clinical characteristics. Again, the idea being to sort of prime the ability for researchers to really get going and look at these outcomes. And then finally, there's beneficiary level CMS claims encounter and assessment data. So this is really facilitated again by the fact that the surveys will include the NPI number and the facility CCN. I'll just point out those will not be available in the data that researchers are actually using. The surveys will go into linkage with that information for the purposes of linking to these other data sources, but then those identifiers will get removed in the view of the data that researchers have access to. But once you have that clinician NPI and the CCN, there's an enormous number of things that you can link to. So first, obviously, there's just the beneficiary level claims data. So for a given survey respondent, you can pull the Medicare claims data for all of the clinical care that a respondent clinician provided, all of the prescriptions that a respondent wrote or fills for those prescriptions. And so obviously there are an enormous number of research questions you can do when you can really get this very granular information about the care this clinician has delivered. And similarly for the nursing home survey, because we have the CCN of the respondent's organization, using that, you can get to the MDS assessment data for any beneficiary, for anyone who spent any time in that organization receiving care there, you have their MDS assessment data. And then you can also get their Medicare and Medicare claims data. So again, you can get really rich and granular information about the residents of the facilities that are participating. At this time, you won't be able to combine this beneficiary level claims data with the other types of data sources that I went through, such as say like the geographic data, just because that opens up a whole host of privacy concerns as you bring in more additional data sources. The final thing that I'll add is, in addition to linking to this beneficiary level CMS data, there are also a host of other publicly available data sources that you can link to using the clinician's NPI. So there are Medicare prepares Part D public use files, which will be available within linkage. Medicare also prepares just additional public use files, both of clinicians and of nursing facilities, such as Nursing Home Compare. Again, for the full list of those additional resources that are available, please refer to the website. So finally, just stay tuned. Again, the plan is that these the surveys and the linked data will be available in March of 2025. We're currently getting set up within the linkage program. And so once those details are clarified, we will have outline the data access process on our website so folks have an idea of what that will look like. Finally, the best way to stay up to date is to keep checking the website periodically. And also you can join our email list so you get updates as additional information is released. Thanks very much for listening.